And Rob and Julie, looking at those state and local numbers, the statewide case number has increased by 10 to 77, while in Central Virginia it stands at 14. Among the new cases for our area, 4 in Richmond that Brendan King is going to tell you about. Also, another one in Chesterfield County and the first confirmed case for Charles City. Meanwhile, state health officials say their primary focus right now is making sure hospitals around the Commonwealth have the supplies they need to treat patients as this virus continues to grow. Chief among those supplies discussed at Wednesday's news conference are ventilators. State officials say there are nearly 2,000 ICU beds in Virginia equipped with them, and an extra 400 can be sent out where needed.
Beyond that capacity, the strategic national stockpiles have stores of medical equipment, including ventilators, that can be called upon to address emergent public health situations.
But officials say they're still determining how many ventilators are currently in use. Meanwhile, health officials say the state lab has the capacity for up to 360 coronavirus tests and expect that number to increase.
We do have adequate supplies to respond to the number of samples that are being approved by the Virginia Department of Health.
Governor Ralph Northam also says he hasn't yet activated the National Guard, but if he decides to do so, those soldiers could help increase capacity at hospitals.
Whether that be with space, if we need to move into other structures, if we need to put up tents as we would in MASH units, if we need more equipment such as ventilators.
Officials also talked about the issue of child care, as about 1,200 of the state's 7,800 daycares have closed. They say they need some to remain open to serve the kids of parents who work in critical fields.
Medical professions, transportation, the food supply, grocery stores, the utilities.
Officials say they'll give daycares guidance to follow the state's recommendation of no more than 10 people in a space, and that will be applied on a classroom-by-classroom basis.
We do not anticipate this will be overly burdensome, but we are asking them to modify their current practice and programming.
And officials are also asking other Virginians who aren't essential workers to please keep their kids home from daycare if they can do so, to free up those spaces for essential workers. Coming up at 6, we'll tell you about some of the other industries the state is working on guidelines to help them stay open during this 10-person limit. Working for you in Richmond, Cameron Thompson, CBS 6 News.